Can I ask you a bunch of intimate questions over the next hour?
Absolutely.
How do you know that you're in perimenopause and it's not irregular bleeding?
I've paused.
Oh, have you paused?
I'm paused.
And is it liberating?
It's amazing.
What exactly is perimenopause?
There is no timeline that we can tell anyone. It could even be 6 or 7 years before the periods totally stop.
Mine also, the first symptom was the insomnia, or sometimes wake up feeling very anxious. So much fun.
Some people, of course, do hormone replacement. I've had IVF, 5 times.
Is there some benefit of getting your periods for as long as you can?
Chances of a woman having a cardiac event is probably as same as it would be for any man.
Of course, we don't want women to rest easy ever.
That's right.
Very little awareness to begin with, so support to dur ki baat.
Is there a connection between HRT and cancer?
There are a lot of things that go into it.
The men in our lives were oblivious.
Why so unfair? Insomnia, sudden weight gain, low libido, hot flashes, night sweats, exhaustion, mood swings, brain fog, anxiety, irregular periods, dry skin, joint pain, headaches, depression, heart palpitations, bloating, irritability, hair thinning, memory lapses, fatigue, breast tenderness, dizziness. What am I talking about? There are over 40 symptoms linked to perimenopause, and most of us have no idea that we're even going through it. Now, I always knew that there's such a thing called perimenopause. I'd heard of it, I'd read about it. I knew it was something that happens before menopause, but knowing about it and actually going through it, now that is a whole different story. We know that menopause means the end of our periods, but what about the years leading up to it? The mood swings, fatigue, sleep issues, all the symptoms I listed, the way your body starts to feel just different. Nobody prepares us for that. Hello and welcome to All About Her, a space where we have honest and meaningful conversations about women's health, wellness, happiness, and self-care. And today's episode is dedicated to a phase that touches all of us, every woman. Yet, it's rarely talked about openly. Perimenopause. I have two Wonder Women joining us today. The first is someone I greatly admire. Both of them I admire. One I admire for many reasons, not just for her work, but also for the way that she approaches life. She's a filmmaker, a producer, and a storyteller who I think has always chosen to walk her own path, whether it's in cinema or in life. Kiran Rao.
Yay, hi.
Hi. Our second guest is someone I trust and I turn to for all of my questions on women's health at any time of the day or night. As you know, I'm harassing you on WhatsApp. Dr. Gayatri Rao is a renowned gynecologist. She has spent years helping women better understand their bodies, guiding them through different phases of life, from puberty to pregnancy to menopause and beyond. And today she's here to explain perimenopause. What's really happening inside our bodies, why these changes feel so unpredictable, and what we can do, if anything, to manage them better. Kiran and Dr. Gayatri, I'm so happy to have you here. This episode, we're doing a bunch of them, is really close to my heart and my uterus for many reasons, because I think I'm in the throes of perimenopause and I have so many questions. So first off, if I can start with you, what exactly is perimenopause?
For us to know what perimenopause is, first let's see what menopause is. So that's the definitive point in any woman's life where you stop getting your menstrual cycles. Of course, clinically, if I say that someone's gone into menopause, I would say that 12 months of no periods is when someone goes into menopause. Anything after that 12 months is called postmenopause. Now, peri, as the word itself indicates, it's before and after. Now, perimenopause would mean that it starts clinically when the periods start getting a little irregular. You start getting some symptoms of menopause. And eventually, it could start probably maybe 7 to 8 years even before your periods have stopped. It could be either in your early 40s. Some people could start as early as late 30s as well. Of course, it's the whole transition from the time you get irregularities in your periods and the other symptoms. You stop getting your period and maybe another year or two after that. But on an average, if I would say it would last around 4 years or so for any female as such.
Just leading on from that question, how do you know that you're in perimenopause and it's not irregular bleeding?
So there could be other reasons of having irregular cycles also. When you have irregular cycles always does not mean. So of course, I shouldn't have a 41-year-old come and say, okay, I'm getting into menopause or perimenopause right away, if the other symptoms don't persist with it, of course. So clinically, irregular cycles could be some other hormonal imbalance. It could be polycystic ovaries. It could be any other medical problem leading to irregular cycles. One, clinically for us to diagnose that someone is in menopause, we don't have definitive tests. Of course, we can always do certain hormonal tests.
Right.
We can do something called as an FSH,
The
follicular stimulating hormone. So it's a kind of a hormone which does start going a little higher as your ovarian function keeps decreasing. More than 10 means the ovaries already started becoming slightly insufficient. When it's more than 20, that means, okay, the ovarian function has decreased further. When it gets to 40s, when I know the ovaries have stopped functioning and I get 2 values of 40, I definitely know the patient's gone into menopause. Right. So yes, we can predict to a certain extent, but there is no timeline that we can tell anyone. So if someone comes and asks me tomorrow, Soha, that, doctor, my periods are irregular, when will I get into menopause? So I can't tell them it's going to be 2 years or 3 years. It could be 2, 3, it could be 4. It could even be 6 or 7 years before the periods totally stop.
Can I ask you a bunch of intimate questions over the next hour?
Absolutely.
Where are you at on this whole perimenopause, menopause spectrum?
I've paused.
Oh, have you paused?
I'm paused.
And is it liberating?
It's amazing to be on the other side.
Is it really?
I mean, some of the symptoms, honestly, that I had in perimenopause persist. But by and large, I feel kind of free of the menstrual, kind of the pain, all the things that we went through when we actually got our period.
Yeah.
And yeah, it took a year to know that I was definitely, like doctor said, I had menopaused. I don't know what the word is. Is it menopaused?
Let's pause.
Menopause.
Just pause. That I paused.
I am menopause.
I feel like if you're paused, then at some point somebody will unpause you.
Yeah,
and
exactly.
So.
Meno stopped. I've stopped.
But you don't feel like you're in a state of like status. You are moving.
Yeah. Well, I'm old, I guess. I feel like I'm on the other side of fertility, I suppose.
Yeah.
So it's now the rest of my life of no period. I'm sure there are women who have many associated issues because your hormone levels significantly change after you've gone through menopause. So there's a lot of dealing with that, and there's a lot of it that tells on your health, both external, like your physical appearance, as well as many, sort of persistent issues that women have even after menopause, I'm sure. But currently I'm not experiencing as many symptoms as I was in perimenopause.
But tell us about that perimenopause period for you. As you said, it took about 12 months to know that you were in perimenopause. And how long did perimenopause last?
Actually, it took 12 months to know that I had actually gotten into menopause, because it takes at least a year of not getting your period to be quite certain, and then you do a bunch of tests to know. But no, the perimenopause went on a good 4 or 5 years for me.
And what were the earliest symptoms?
The earliest symptoms, of course, were, like doctor said, a very, very irregular period. And, just when you thought like you'd gone 3 months without, then you'd suddenly have like a period that lasted for like 3 weeks or something, Very odd menstrual cycle that was unpredictable and most annoying. And then, kind of other symptoms that I had, which were actually tougher to deal with on some level than this. I felt very much like my sleep had gone for a toss. I had a lot of trouble sleeping, and that actually symptom continued through menopause, and I've now learned to manage it quite, I think, effectively post-menopause, but it's one of it was my major symptom. Like, I didn't get hot flushes and many of the other things that other women do get. I didn't put on weight and lots of the things that are quite common during perimenopause. Mine was mainly sleep.
I think mine also, the first symptom was the insomnia, which suddenly came out of nowhere, and I would lie awake in bed, just not being able to fall asleep, or sometimes wake up feeling very anxious. And I, of course, turned first to my GP, saying what's going on, and he addressed it as a symptom, as in, okay, if you have insomnia, then try melatonin, and try meditating, and I felt like that wasn't really helping. Until then, somebody else, usually it tends to be friends who have experienced this, I find, who then suggest, oh, perhaps this could be perimenopause that you're going through, and this is one of the symptoms, and then of course you look it up, and there's about 3 million symptoms of perimenopause. There's a lot that happens.
It is, yes. So, well, if you say symptoms, yes, you start with your irregular periods, but irregularity, like you said, it could be because you will get irregular, but there are days, months where you would get very scanty periods. You could spot for a long time. You could get a very heavy cycle, which goes on for a month. And that's all your hormones going a little up and down in your body.
So it typically doesn't happen, like I'm saying, if you're trying to map it, can it be that for the first year or so, couple of years, you get 2 periods a month and then it becomes, like, is there like an early perimenopause and then a later perimenopause?
So I would say maybe 2 or 3 years leading to menopause as such, we would say it's late perimenopause. That's where your symptoms would become a little bit more pronounced as compared to when it would be when you're just getting into it. Because initially it might just start as irregularity of periods, like how Kiran said. But yes, other symptoms finally set in. And when I say other symptoms, of course, the most disturbing for most women is vasomotor symptoms. That's the hot flushes that they get. Of course, that's very, very troubling. I mean, women who don't get it are very lucky, I must say, because that's a very good aspect of it, because the whole spectrum can be from mild to moderate to severe. And when I say severe, someone could be getting a hot flush probably every 3 minutes, lasting for like a minute or so, and they just keep waking up from their sleep. And that's the commonest cause of insomnia again, other than, of course, the less hormones, which of course trick your brain. See, because whenever we have hormones, we have the happy hormone, which is the estrogen. So estrogen, ideally, whenever a female gets into puberty, the estrogen and the progesterone secretion starts. Your ovaries is what secretes all the hormones. And these hormones are chemical messengers which will reach through your blood and to all the other organs of your body. And you won't believe it, but each and every organ, estrogen does have a function. So in your brain, your emotions, your limbic system, or your prefrontal cortex, if the estrogen is suddenly started becoming less or starts getting depleted in this whole transitional period, so what's happening, there's an erratic secretion of estrogen from the ovaries, or it starts getting depleted slowly till the time you get into menopause. Now, as the estrogen is depleting, the progesterone is another hormone which is there, which balances the estrogen. Sometimes you don't ovulate, that's why there's no progesterone in your cycle. That again gives you other more mood swings.
Progesterone is the one that helps you support a pregnancy?
It does, yes. So it's not just supporting the pregnancy. Mid-cycle, once you've ovulated, the progesterone secretion happens, and if you're not pregnant, of course, it's withdrawn and you get your period.
Right.
So that's where the irregularities. More estrogen through the cycle with no progesterone causes a very thick lining, and that's when you start bleeding heavily and you just wouldn't stop.
Right.
So those things can happen because of the imbalance. And of course, the other symptoms, like I was talking about, the vasomotor symptoms, again, because vasomotor symptoms are also, there's a thermal regulation which happens in your body. When the estrogen becomes less, that the neutral thermal regulation zone gets a little narrowed.
Right.
So a little change in temperature would cause a woman probably to go into a hot flush. Or a little decrease in temperature, suddenly in the night, probably you might just get up shivering and you don't know. That's because your blood vessels are either dilating or vasoconstricting. Now these, of course, there's a lot of physiology behind it. Other symptoms, of course, a lot of genitourinary syndromes, like what was GUSM, that is genitourinary syndrome of menopause, where eventually what happens, the no estrogen causes thinning of the mucosa of the vagina, the urethra. So your whole, your urinary system, you start getting more urinary infections. You would get more vaginal infections. There's dryness in the vagina. Of course, there's decreased libido. So a lot of changes can happen. And of course, less estrogen also sometimes in the prolonged phase can also lead to some sort of genital prolapse. See, because then you don't have estrogen which was supporting or rather giving you a good pelvic floor support. You know, the estrogen was keeps all the fascia and the muscles good and active.
Right.
And in case you don't have that, there's not enough support, a person can land up having a prolapse post-menopause. So there are a lot of things that go into it. Like I said, there are millions of things that can happen. Millions of, yes, symptoms. And I would say, yes, maybe a headache, maybe...
headaches.
Yeah, so the headaches also, the insomnia, the mood swings. There's so many symptoms, and I think quite a few of the symptoms can be explained because of you going into perimenopause.
I'm saying there's so much going on, and of course women are used to suffering in silence and not talking about menstruation, loss of menstruation, especially when you stop getting your periods, I feel, because of the loss of fertility that comes with it. There's an association of you being less womanly, less fertile, therefore less of interest to anybody. Nobody's interested in you anymore. There's nothing written about you. Nobody is really talking about what happens, even in terms of medical research. Perhaps because it's not, you're no longer capable of creating life, so bye-bye. But I'm saying, but now are women talking about these things more? We're experiencing all of these things. We're aware of all of these things. But do people in your circle talk about it more openly, do you feel?
Absolutely. I think perhaps because
also your circle is a very good circle to be in, I want to say. You're lucky.
It's also a bunch of women around the same age who are sort of, hitting these sort of markers at the same time.
Yeah.
And all of my friends kind of have had different experiences with menopause. Like some friends who've had hot flushes, I've seen them suffer through it, where it's most uncomfortable. Your, body temperature regulation just goes for a toss and they're never happy. It's too hot or it's too cold and it's really annoying.
And this can last for
It can go
years.
on, and others have, unexplained weight gain despite doing a bunch of things. The period just never settles, and like she said, it's a very elastic period. So, I think it's become far more sort of talked about. I'd like to say, at least in urban circles, you hear the word menopause much more frequently, perhaps because I'm of that age and everybody I knew was hitting it at one point or the other and comparing symptoms and sharing home remedies and knowledge.
Which we will come to later.
Yeah, but that's, it's trying to support each other through it because it's a very difficult phase for a woman. I guess the human body wasn't meant to live this long and have babies this late, and we've pushed, the limits of just existence. And on some level, we are, as women now, realizing that, look, this is a serious thing that we do need to have much more research, much more support about, and we kind of like want to help each other through it, I guess. So we've talked about it a lot.
Do you feel also amongst the people who come to you, there's more awareness?
So, I would say as a gynecologist, I would have expected to see more women come to me with problems of perimenopause or menopause. Yes, the awareness, I guess, is happening now with the whole, the social media and a lot of things on Instagram. In fact, sometimes I have women as early as 30s come and tell me, now I have an irregular cycle, I am in perimenopause. Because that sometimes gets a little, But for me, if I would say, let me say, if I see maybe 30 or 40 patients in a day, I do not see more than 1 or 2 women come up to me for problems because of perimenopause or menopause. So it's probably maybe people are aware of it, but not too many women tend to come and take help because...
Why do you think that is?
I think probably, like she said, maybe to try all the home remedies initially and you have friends. Now, support groups are important, I totally agree. And I also feel that you need to have some menopause clinics, maybe to get the women to, understand that, of course, you have a problem. They might not just want to come and straight away tell us, but if you have a menopause clinic where we have like a multidisciplinary approach, where we have a gynecologist, maybe an endocrinologist, you have someone, a nutritionist, a lifestyle coach.
Absolutely.
And so this is the kind of thing which we always think about, but I guess no one just lands up. I've thought about it quite some time back, but I still haven't gotten around to do it.
Right.
Because I think that really helps because if you have a support group, like you said, if you have friends, that itself will help them get through it.
It also helps that we were aware of it to begin with.
Yes.
Like we sort of knew we were hitting that mark, but most women, I suppose, are accustomed to suffering, accustomed to their periods giving them trouble, having PCOD or many other issues, and then just soldiering on through it.
Yeah.
So, I guess when you hit perimenopause, you think it's okay, yet another
a part of your life.
par for the course as a woman,
Yes.
which is one of the issues. I think a lot of people then don't get simple help that they could because all of us visited our gynecologists and got, whatever tests done, whatever remedial stuff that we could have, we would do, take, some people, of course, do hormone replacement, which actually got such a bad rap at some point. But some of my friends in the US are on HRT and doing, and it's kind of scientifically done to prevent you from suffering and, because the shock of the loss of the hormones affects so many other things, including, bone health and so many things. So, so it's important to visit your doctor is, I think what most
I want to
women
come
know.
to the remedies later. I'm not done with the suffering yet. There's more to talk about the suffering. I wanted to ask, you said that it's tough to predict when someone will go through it. Is there any kind of indication you can get from when, for example, your mother, because I know a lot of questions people ask is, do you know when your mother menopaused?
Correct.
And that might be an indication.
Yes, so there is no hard and fast rule. It's not set in stone that your mother got menopause at a certain time that you will. But there is a positive, there is a correlation. So in the sense, generally, that is what it happens. Genetically, if I see, if a mother's gone into menopause at 50, the daughter would go into menopause probably a year earlier or around the 50s. So there is a correlation which is present genetically. But there are other factors also. I mean, I really wouldn't say it's a genetic age, it's the lifestyle that you lead. I mean, there are so many other factors which also could affect the age of menopause. So, I mean, I would have a patient of mine whose mother's gone into menopause at 50, but she's going into menopause at 45. That's again all the environmental, the lifestyle,
That's
not
what I wanted to ask.
exercising.
A lot of people are saying, for example, girls are hitting puberty earlier, sometimes because of nutrition, because of lifestyle.
That's right.
Is that also happening with menopause? Environmental factors are affecting?
It is. We see that women, in fact, getting into menopause at the age of 45 and 46, which is very early, even with Indian standards. So Western women, of course, undergo menopause a little later. So they menopause, let's say, in their 50s, 52,
Why?
55. That's the genetic makeup, how it is. The Caucasians, they always have a little later menopause as compared to the Indians. So all of us, we get into menopause generally by 48, 49 or 50. But nowadays, we do see women who are coming at menopause, probably menopause by 45, where the periods have stopped. And though the family history does not exist, that the mother would have attained menopause a little later in life, but it's the environmental factors again. For example, you said puberty. So we always say that the kind of food that we eat now, with all the preservatives and all packaged food, most of the things, we always see that there are certain sort of hormones used or something to grow them. So that's the reason the little girls are getting puberty earlier. And once you get puberty early, of course, you're also looking at menopause a little earlier.
Milk as well, apparently.
That's what. So milk and all of these have hormones, because for milk also, I think the cows do get a lot of hormones.
Right. Growth hormones.
Yeah, that's right.
Yeah.
I feel like a lot of people, like I was saying, insomnia, a lot of people mistakenly assume that they're suffering from something else, and they don't attribute it to perimenopause until later. You touched upon it, but can you tell us a little bit more about how you knew that this was perimenopause from the get-go, or did you ever mistake any symptoms for something else at the beginning?
So I've had a very sort of tricky relationship with, sort of my gynecological self, let's say the fertility aspect. And, over time, that's been something that I've paid much closer attention to than perhaps most women have, because I've had all kinds of issues with fertility. And so when my periods started to become irregular, I kind of automatically assumed that I've had IVF, 5 times. I kind of assumed that it was something to do with perimenopause or something. And I checked with my gynecologist, and it was, in fact, perimenopause. And she said very similarly that you don't know how long this phase is going to last. And she was actually she put me on a pill for a little while. And I didn't really want to continue taking the pill for very long. So I actually went to my homeopath and, was taking some homeopathy for it. But my key symptom turned out to be insomnia. And it also happened to be roughly around COVID. So it was a very strange time in any case. And there were a lot of stresses, I think, in general on all of us at the time. Anxious. Are we just anxious because of, everything that's going on in the world? So there were multiple factors, I think, that kind of contributed to my insomnia. But I think what perimenopause and this insomnia did was really made me focus on myself after many, many years of just looking after everybody else. I just had to dig in and figure out what was going on with me and figure out ways in which I could deal with my insomnia, my changing body. I could definitely tell that, my skin was drier, my hair was drier. There were like many sort of smaller symptoms that I was picking up on, and because I had all the time in the world during COVID. And yeah, it was a sort of a beginning, I think, for me. It was the beginning of a new chapter, which I actually quite was happy for, because once it settles down, it's kind of a phase that leads you to a new chapter in your life, And if you look at it like that, your body is changing, and you have to accept that it is. Yeah. But you sort of find ways in which you can accommodate those changes without being so hard on yourself and clinging to the self that you're losing, because you realize oh my God, that's my youth going away from me or something, and that's life. And you kind of learn to...
your youth will go away from you.
Yes. And it's nice to be able to find ways that you can deal with in your everyday life. So I changed the way I dealt with myself.
I think that becomes much easier when you've got the right voices in your head as well, which I'll come to. Just generally transitioning in any way is so much easier when somebody is happy to see you transition and evolve, and you and someone else not holding on to a younger or different version of yourself. A couple of things you touched on was like the pill being recommended and you not being happy with that, which I wanted to come to in terms of various ways of dealing with perimenopause. But before that, again, if you can just break it down for some people who may not know, including me, what exactly is happening to your body hormonally, basically, when you go through perimenopause, with reference to estrogen, progesterone, does testosterone come into it?
Now, every female, the female hormone we very well know is the estrogen and the progesterone. Now, of course, people might be surprised, but yes, we also have a part of a male, the androgen. That means the male hormones also are there, which are secreted by the ovary and the adrenal glands. That's the testosterone, something called as the DHEAS, and the DHT, which is the dihydrotestosterone. Now, all these hormones, of course, play a lot of role balancing each other. Like I said, the estrogen and the progesterone always balance each other. The androgen secretion, a female ovary will secrete, of course, it's probably 1/8 of what is there in males. So when we're getting into menopause, the secretion of the estrogen and the progesterone from the ovary starts getting very erratic. So it starts declining, like I said, over a period of time.
Does one happen before the other? Like I feel like my progesterone has decreased, but my estrogen is still high.
So because what happens is that generally when you're getting into perimenopause, you start getting something called as anovulatory cycles.
Yes.
That means you're not ovulating. See, because you're probably getting into that point where reproduction is not as important. You're getting into your 40s where you probably are looking at, you're getting the other part of your life all in order. So anovulation starts happening and the fertility starts decreasing, of course. Anovulation means there's no release of the egg from your ovary. Unless and until the egg's released from your ovary, there's no progesterone secretion in your body. So yes, of course, the progesterone level does drop. And unopposed estrogen, that's high estrogen in your body, if it's there for a longer period of time, not only gives you heavier cycles, but of course other aspects of hyperestrogenic state. So
like
we do
PCOS,
get a little, yes, so all those other symptoms do start coming into play. And like I said, when the estrogen starts dropping and the progesterone starts dropping, you start getting all the other symptoms, your insomnia, and everything can be explained to depleting hormones at that stage. The testosterone level, which I said the ovary does secrete it and the adrenal glands also do secrete the testosterone in a female body. When the testosterone and the DHEAS levels start dropping, it does decrease your libido. So testosterone is very important for having a normal libido in a female. So that libido also does come down when
so
the
in
testosterone
both males and females, testosterone
does drop.
is an indicator of your
yes. And of course, the lesser the testosterone, you do start feeling a little tired because whatever said and done, it does give you some sort of boost your muscles. So you start feeling a little tired. You start feeling, all the symptoms slowly set in where you go into depression, anxiety. And so the withdrawal of these hormones gives you all kind of symptoms later on eventually. And the long-term effects, of course, is, like I said, the thinning of the vaginal mucosa, which causes dryness. All that sets in 2 or 3 years later.
It's so much fun. Aren't there any happy symptoms of perimenopause? No.
No periods, you don't have to use.
Yeah, I guess that's a big one.
That's
a big one. But then we go around trying to prolong, as long as we can get our periods. Is there some benefit of getting your periods for as long as you can?
See, the longer you get your periods, you still have your hormones. So the estrogen is there in your body for a little longer. Of course, excess estrogen might not be okay, but as long as you have a balance of estrogen and progesterone in your body, you don't age as quickly as you would otherwise without the estrogen. Yes, so it is beneficial, but again, excess of anything is not okay, too less of anything is not fine.
Did you feel like the symptoms of perimenopause, menopause, did they have some kind of impact on your day-to-day life? Days difficult for you, both professionally or personally?
I did feel more tired. Like she said, I tended to have slightly less energy, and I'm a super energetic person, so that really affected my mood and how I felt about everything. Anyone with insomnia will tell you, you just feel really annoyed with the rest of your day when you haven't slept at night. Yeah. So it affected my mood, it affected my productivity, but it would also, like I said, helped that we were doing this. I was having it through COVID, and there was no real work-life balance of any kind. But my symptoms persisted long after COVID, so I had to learn to manage them somehow. I think with the energy cycle, you slowly realize how important it is for you to have an exercise regimen, for you to have some sort of clean, good, nutritious food, and sort of all the things that you ignore when you're younger and don't think about those things, and everything's fine. So it did. I don't feel it affected. Luckily, I did not have the mental health side of effects. Like, I didn't feel depressed, I didn't feel anxious. I just felt annoyed at not having slept. Which is,
like ever in like loss of control of your emotions?
I was also going through a divorce at quite the same time. I mean, I had everything
so
come
COVID,
together.
all that is happening.
So there was lots of things happening at one time, and I have a feeling, I don't know what affected what, whether COVID made me go into menopause, which made me get a divorce, or divorce made me get a menopause. No, I'm just I doubt.
So you know what? She's right. I mean, for women,
don't think divorce can cause a
menopause. No. Perimenopause comes at a time in your life when already there are so many other things to be taken care of. Your children are growing up, they're getting into the teens. Not that they're easy in their teens either. You're managing with teenagers, then you're managing, probably you're in your profession, you're at a place where you have to give your maximum. Because, after the 40s is when you're really peaking in any kind of a profession. So that 40 to 50 is very important for people. And that's the time when your hormones are playing on you. You can't sleep, you have all the stress possible. So stress comes from all. And of course, being in a marriage for such a long time, by the time in your 40s, probably yes, there would be friction, and your hormones becoming less at that time doesn't help.
There's friction, and
of course.
Exactly.
So
what you need is lubrication to help with the friction.
Absolutely. So there are a lot of things I think which are going on in your 40s, and that's when the perimenopause starts. So yes, it doesn't help not to have your hormones at that point, but of course you can't say that that's what leads to divorce.
Do you feel like of course, women come to you sometimes. Do men also accompany their wives or their partners when they're going through this journey?
They do.
Like sometimes I want to take Kunal with me to say, look, I'm not making it up. And look, I want this professional to tell you what I'm going through, because I don't want to be that whiny person at home saying, oh, I'm not feeling this, or, I'm not interested so much in sex right now, or like there's dryness, vaginal dryness. These are not really romantic conversations that you want to have with your partner, but sometimes you would like them to be aware of it.
You're right. So yes, there are men who do accompany their wives.
Wow.
But most of the times when they come, of course, they would start with complaints that, I need to tell them that you're going to have mood swings. They said, oh, I'm already used to that all my life.
So all the joking.
I think all the joking and all that stuff comes in. But yes, I think it's, like I said, it's very important. When you menopause, it's not just you. I think it's the whole family who's going through a lot of transition. Because yes, you will have mood swings. I mean, there are kids who come with their parents, I would say teenagers at that aspect or whatever, who come and tell me, oh my God, my mother's at my case. Can you please do something about it? She's menopausal.
Right.
That's a very common thing that I do get to hear from teenagers when they come with their mothers. That's because they don't understand.
Right.
They don't understand what the woman is going through at that particular point. And I think it's very important for us to create that awareness that, so that the kind of that they need to have their support of their family, not just friends. Friends do understand because they're your age and they're going through it. But family also does play a very important role.
So is that happening?
It does happen, yes. But like I said, most of the times I hear only complaints. I don't really hear that, that I am understanding that, I think that'll take a little time for people to get aware of it and probably support them a little bit better.
I think there's very little awareness to begin with, so support to dur ki baat.
I was hoping in your circle, because I looked to your circle.
In my circle,
it's
yes.
enlightened circle of people who are
but then we are like not even like a fraction of India, and the women here, I mean, how much access do they have to health?
I think if you can explain, because I didn't experience it, you didn't experience it, hot flashes for some people who might not know that this is something that is happening to them. Physiologically, what is happening in the body, and is there something that they can do to make it better?
Hot flash and then a flush. So basically you feel really hot. There's a sudden increase in temperature. Your face is going to feel hot, your upper body, your neck. Followed by a flush. When I say flush, that means once the core temperature has increased a little bit, your body responds by getting the blood vessels to dilate. So that means when the blood vessels dilate, that's basically to dissipate the heat now, and that's when you start sweating and you turn red.
Right.
So that kind of a flash followed by a flush is what a hot flush is. Of course, it could, like I said, last sometimes maybe for a few seconds, but it could last even for minutes. Now, it totally depends. Like I said, depending on, not all women get it, but when they do and it is so severe, It is to a point where they can't sleep in the night. And again, not sleeping in the night also increases the stress and all the other problems which follow that.
And magnesium will not help that.
Magnesium does not really help that.
I feel like magnesium is my answer to everything these days.
And generally, yes, again, this is because of the lack of estrogen, because like I said, there is a regulatory, your hypothalamus, which is what controls the temperature in your body. And that the whole neutral zone where the temperature is maintained gets changed because of lack of estrogen. And a little change in your temperature is going to give that adverse reaction, in the sense your body responds very differently than what it would when you were younger and you had the hormone in you.
And a question like microdosing of estrogen to help you through this is not a possibility?
It is a possibility. So if someone comes to me, and of course this, like I said, starts happening more a little later when you're nearing your menopause also. So in case we have to treat vasomotor symptoms, that is the hot flushes, there are different medicines which are available which we can help them with. They don't really have to go through it so much. There are certain class of medications. It could be a little estrogen. It could be a kind of something called as a gabapentin, there's a clonidine. There are different drugs that we can use, or maybe consider even HRT for those patients at that point, because it does help. So going on these medications at least improves the quality of your life. And in fact, this is one of the indications where a patient has severe hot flashes that they need to go on HRT.
Right. That their quality of life is really being compromised.
Absolutely.
Something again that you didn't face, but I feel like I didn't put on any weight till even after, I mean, of course, when I was pregnant, but then I lost that. But I felt suddenly I hit 44 and just a couple of kilos went up, little around the abdominal area. That is also something that happens at this stage in your life?
It does, because so of course, like you said, you get that little tire on your tummy.
Yeah.
That's the typical way perimenopausal or postmenopausal woman's going to start putting on weight. That's again because when there is no estrogen in your body, the fat distribution, whatever happens generally, it happens more in the centripetal area. So the visceral fat and the subcutaneous fat, what we say, increases more around your abdomen.
Right.
And that's the fat which is very, very difficult to lose. And of course, like I said, a lot of patients do come and they say, you know what, I'm eating the same. I'm doing the same amount of exercise, but nothing seems to work. And all that's happening is I'm putting on weight. I mean, year on year, I see there's a little bit of weight on my tummy, which is just not going. And that is a very, very normal thing, because we say the fat distribution from that gynoid turns to an android fat. That means from a female distribution to a male pattern distribution of fat.
Oh, I
so
see.
that becomes,
What we associate with men.
That's right.
Oh my God. See, I knew it wasn't my fault.
So again, I'll come to how we can potentially deal with abdominal weight gain and things like that, and whether it's just a couple of extra crunches in the gym, which my trainer seems to think is the solution, or not. What about the long-term health risks, if any, that are associated with perimenopause? The one that I'm aware of course, is the loss of estrogen, which increases the possibility of heart disease.
So long term, when you talk about no estrogen in your body, yes, heart disease, like you say, I typically tell everyone that by the time in your perimenopause, or rather when you have your estrogen in your body, you hear very less number of females having a heart attack, right? So basically, estrogen is a very protective hormone, which protects the cardia, doesn't let what we call, deposition of certain cholesterol crystals or anything in your blood vessels, which could lead to a heart attack later. So, of course, as the estrogen decreases, and when a woman gets to menopause, and of course post-menopause, the incidence or the chances of a woman having a cardiac event is probably as same as it would be for any man.
Of course, we don't want women to rest easy ever.
That's right. No, so whatever the benefit was is gone, and that's the reason cardiac disease, of course, happens more in later stages in our lives and in a woman's life, basically. So if you see any kind of a woman undergoing a bypass or any other kind of a surgery, it's going to be only when they're in their late 50s or maybe in the 60s, not when we are in our 40s or in our 30s at that particular point.
I believe that then the later the heart goes into attack or arrest, it's the best kind of heart attack to get later in life.
You just sleep and then you don't wake up.
I mean that it doesn't kill you. I mean, when you're younger, the younger heart might,
Recover faster.
Right.
So,
I feel the younger heart doesn't recover faster. I feel if you get a heart attack when you're 30 or 40, it could be fatal, as opposed to maybe if you're post 70?
So again, when we talk about an arrest and a heart attack are two different things. Yeah, of course, a heart when it just arrests and stops beating can be resuscitated, of course, and immediately can get back to beating properly. An attack, on the other hand, or what we call a myocardial infarction, is when your heart muscles are not getting enough blood. So when the blood supply is less, the muscle goes into ischemia, and that's when you start getting that pain. So that's when you get a heart attack. Of course, a heart attack, like I said, can happen because of the vessels narrowing in your body, and of course I mean, during the time when we have estrogen, we have the protected cholesterol. The HDL, is a good cholesterol which a female has, and is a little higher in females because of the estrogen, and protects us from getting any kind of cardiac events early in life. And of course, after menopause, like I said, the cardiac events would be as same as it would be with any man. The other long-term effect would be your bone density. So basically, estrogen is important to maintain a certain bone mineral density, because the calcium deposition happens in the bone, a certain calcium is also getting absorbed. So what happens once your estrogen starts becoming less is the deposition is not happening, but the absorption of calcium from the bone is still happening, and your bones start becoming weak. So you get into something called as osteopenia, where the bone density has decreased, but not to a point where they start breaking when you just fall down. When it increases a little beyond a certain spectrum, you get osteoporosis, where the bones become so brittle that if you're just standing or sitting and you fall, you can break your bones. Of course, the bone density decrease after menopause is as much as 0.5 to 4% per year. So by the time you've lived your life, you probably would have 50 or 60% of your bone density is already gone, and you've gone into osteoporosis. So these are the long-term effects of menopause which can happen. Main, like I said, is cardiovascular disease and osteoporosis.
Have you thought about these two things, like the health of your heart and the health of your bones?
Health of my bones, I have been thinking about. I think I have osteopenia, like most women do. I've checked my bone density for some years now. I keep checking. Heart health also, I mean, we do our basic blood work, but I have yet to do one of those stress tests and other more complicated ones, which I ought to, honestly. But yeah, you do get aware that there's a lot more tests to be done a lot more frequently. Also, once you come towards perimenopause and you get into menopause, you also become aware that you have to start looking at all the markers for cancer, all the other kind of diseases that set in after a certain point, and you realize younger and younger women are, getting these diseases, and especially in families like mine where there is a history of cancer, you kind of start screening for, especially cervical and breast. And
my friend, around her birthday, makes sure that she does like a battery of tests. Do you do that? Do you take that seriously?
Yeah, I do. I try to do it early in the year, every year, like do a January, like around Republic Day kind of thing. I mean, I tend to forget and it varies, but yeah, but like every 12 to 14 months.
And what are the two tests what are the tests that you would recommend to check on the health of your heart and your bones that women should do?
Bones, like she did mention, the bone densitometry. That's a DEXA scan, which we always do. And yes, I always recommend by the time you're getting into perimenopause, you should start screening your bones to see in case you've already reached osteopenia. Because once you've gotten to osteopenia, you can at least intervene and get your bones not to get to the other stage of osteoporosis.
By taking lots of calcium?
Calcium, and there are others. So it depends on what level of osteopenia you are at. There's a certain score that we all calculate, the Z and the T score, and depending on that, you decide whether only calcium is enough, calcium and, of course, vitamin D, because D, unless until you don't have D, the calcium doesn't get absorbed. So you need to have adequate amount of D in your body, and the parathyroid hormone, of course. Other than that, of course, there are enough drugs, some different types of drugs and injections which are there, that if you're getting to a point where they feel that you could go into osteoporosis, you start taking those either injections once in 6 months, once a year, or you go on certain tablets which could to a certain extent at least halt it, and osteopenia maybe reverse it slightly as well. But not osteoporosis. There, once you get there, you really have to work hard with your bone health then, yes.
You're aware of this and you're doing steps to reverse the osteopenia.
Yeah, I thought I was, but I need an appointment, double quick.
So I want to get to medicines and supplements in a little bit. We'll go there gradually. We're done with the suffering part. We're now addressing the issues. What about simply people come and say lifestyle changes. What lifestyle changes can I do? People who want to avoid medication, who want to take a gentler route to sort of address the symptoms of perimenopause, perhaps make it better. So whether it's diet, lifestyle, what are things that you could recommend?
So I think lifestyle, like any other time, you have to be a little bit more at it now. So if I say that you exercise earlier, now you definitely need to make sure that you do exercise.
Yes.
It's not just that, so that's one very important aspect, because exercise.
What if you have exercised before? Does that make things easier? Is it preventative?
It definitely does. See, because you already have good strength, you have muscles, So basically what happens is, because after menopause, your muscle mass also starts decreasing. Not just your skin. Your skin, of course, the turgicity, the elasticity, the hydration of the skin comes down. Even the muscle starts becoming a little atrophic. So all those things, if you do not exercise, of course, will get exaggerated quite a bit. So if you've already been exercising, it's a big help while you're getting into menopause. After menopause, I in fact tell women that you need to probably work a little harder now than what you were working earlier. So it's not just your exercise, but again your diet. And diet, I think all of us know that you have to avoid taking sugars, simple carbs. And as it is, like I said, a lot of preservatives and a lot of packaged food is and caffeine, of course, that's another thing that we tell people, that the more the caffeine you take, insomnia, especially maybe probably after 4 in the evening, don't have a coffee. Because that's going to...
After 12 in the afternoon for me.
All right.
That's it. I don't have coffee after that.
And of course, other things like alcohol, smoking. Once you have, and a lot of lifestyle modifications need to be done. Your diet, again, of course, eat more of proteins. Of course, you can't have only a protein diet, and you can't do fads like going ahead and doing only intermittent fasting or going on a keto diet. No, you need to have a healthy diet. And I think that's very, very important. When I say a healthy diet, it has to be a balance of proteins and carbohydrates as well. You can't say I'm going to be off carbs totally and not have carbs at all. I mean, eventually, the cholesterol, all the hormones that are made in your body are made from cholesterol. If you're not really having any fat in your diet or anything at all, where does the remaining, so there's a particular type of hormone which is still made after you're in menopause by your ovary called the estrone. So estrogen is 3 types, the estrone, estradiol and estriol, that is 1, 2 and 3. Right. So the estrone is one of the hormones which is still produced in the ovary after you're in menopause, and some production happens in your peripheral fat cells and adrenals. So if you're not taking your diet properly and not really including the right kind of things, your hormone production could also get affected. Mm-hmm. So all these hormone production, the whole cycle cascade, what happens, it needs certain kind of minerals, it needs certain supplements. For example, it's important for you probably to have a little bit of zinc and take your omega-3s and take all the other antioxidants as well. So all these are also used by the enzymes while the chain reaction is happening to form a particular hormone. Right. So your diet is very, very important, that you need to take a balanced diet. And exercise, of course, not only for the fact that your muscle mass it maintains, of course, exercising also is going to keep you active, endorphins, makes you happy. And other than that, also the balance. I think that's also very important. Once you're exercising and your core is strong, later on in life after menopause, at least you decrease the risk of fall. Mm-hmm. And that would later on lead to fractures and all the other long-term complications. And not only this, an exercise I feel, so I think a lot of people don't, is pelvic floor exercises. Like I spoke to you about pelvic organ prolapse, which happens more often after the estrogen is out of your body once you've gone into menopause. So it's very important to have your pelvic floor strong, and that would mean doing all your Kegels exercises and other pelvic floor exercises. And you have,
I started doing them now. Yeah. As I was listening to you, I started.
Well, so that
good for you.
But it is important, because later on you don't want to get into that point where maybe not a uterine prolapse, your bladder's prolapsing, and you have all the other genitourinary symptoms later. You have incontinence and all the other problems. So prevention
we have enough on our plate. Thank you very much.
Yes.
Uteruses are like coming down.
It does, yes. So see, there's a pelvic floor.
Descending.
You have muscles in the pelvis which actually are holding things up for you. When the muscles get weak, once you've gotten into menopause because of no estrogen, the fascia is already, of course, women go through childbirth as well. So that itself does damage a lot of muscles and the fascia which is there in the pelvis. And if we don't take care of it, prolapse is something that we do get to see in our patients.
Right. Lifestyle changes. Mm-hmm. You said you started you started self-prioritizing and said, okay, I've looked after a lot of people my whole life, but it's very important now to look after myself. So typically, what does that entail?
That entailed actually also trying to figure out what made me kind of feel better about myself. So it was a lot of, oddly enough, reflection, self-reflection, studying meditation, studying, because you suddenly start looking at this vessel you're in with completely different eyes. I literally used to be only in my head, and menopause made me come back into my body almost, I feel. I began to really
That's a really nice way of
look at myself differently, and it forced me to also start understanding what the self is. So I went on a really wonderful journey of discovery. Meditation helped a lot. It continues to help. A lot of texts that I would read would also put me to sleep, and those would,
That was intentional.
That was also intentional. I mean, I literally have some texts that I listen to fall asleep. I think a lot of people do that now.
So the apps that you like.
There's lots of great apps. And then just having better sort of sleep hygiene, like before I sleep, trying to read and putting my phone off, being very mindful of the fact that I shouldn't, I should keep that hour to, sort of cycle everything down a bit and get ready for bed.
What time is bedtime?
I mean, it varies, of course. Like yesterday, I slept really late and didn't sleep well as a result.
Yeah.
And, the night before, I slept at 10:30, 11. But usually 11, I have to be up by 6:30 or 7 most mornings for Azad. But also, learning to deal with insomnia, because it's sometimes there despite everything. And that actually led me to something called cognitive behavioral therapy, where you actually, sort of get out of bed and don't continue to toss and turn. You get out and do these things that, because it kind of trains your brain to realize that the bed is only to sleep in. Don't be in it if you're awake.
Understood.
So get out, do other things, write, read, knit, anything but look at your phone and watch
You
a
knit?
show. No. Just suggestions that are non-screen based. Paint, I mean, I don't know, cook.
Do you do any of those things? It's like, no. I'm just suggesting to other people who are interested in knitting, cooking.
I read.
Okay.
Yeah, because
paddle?
over time, it really does help to kind of trick your brain into knowing that, okay, 1 second, I really am sleepy. Can you please go back to bed? And then it goes to sleep. So those kind of things help me. For instance, drinking coffee doesn't affect me as much as it does a lot of people. But I know that the screen time 100% affects me. And it was one of the reasons I literally got off Instagram for a whole year. I was just like not on it before the release of my film. For like 2 or 3 years, I just wasn't on it.
You get into that scrolling.
Yeah, the just
universe.
doom scrolling habit. Yeah. And I feel like a lot of those things helped. It would really help to put a lot of these things into some sort of, module that women can use in the future. So I'm really happy you're doing this. And when we talked about it, I was like, yes, please, let's do this. Because more than anything, it's great to have someone tell you that it's all okay and there are ways around it. And then there are small hacks that people can crack and, maybe work for you.
Yeah.
For instance, melatonin didn't work on me at all.
Neither.
And magnesium glycinate works on a lot of people, also did not work on me. For a while, I was taking actually a very, very micro, small dose of a sleeping pill. And I was shooting my film. And I literally would, I had really, really hectic days. I was leaving at 4 in the morning, so I had to wake up at 3. And I would not sleep till 1, and I would do 12-hour shooting days. So, you learn to figure out what works and what doesn't, I think.
Is the insomnia better now?
Much better, yeah.
Natural remedies, like there's a bunch of like mushroom therapy now. Have you tried that?
I have not, no.
Reishi. Which one is the one for sleeping? There's one.
Yeah, there's a lot of mushroom things. I even took these kind of CBD sleep gummies.
And which work?
Not really, honestly. None of these things really worked as well as, just kind of training my brain. And I go through phases even now. Like there'll be phases when I'm sleeping super heavily, and I guess it again is to do with the fact that my body isn't really, your body still continues to change, and some hormones are being secreted and others aren't, and you learn to kind of cope with it. Change in places, locations. I find it really hard to sleep when I go to a new place.
Same.
Yeah.
Are there any kind of fitness routines that are especially beneficial for this phase in your life? Like my trainer is making me jump. And I was like, I look very silly.
I've
He said,
seen
"It's good
your
for your
videos,
bones."
Soha. You do all kinds of exercises.
No, I have not posted the jumping one because I look very silly. And I was like,
I don't think everyone can do what you do.
I just do into two, so it looks like I'm doing it very fast. But no, but I enjoy working out.
Yeah.
I've always enjoyed working out, but strength training is something I've embraced in my 40s now because I've been told about the advantages of building, about the loss of muscle mass, about the loss of bone density. I want to, I see my mother at the age of 80 and she's like, I wish I'd done this, that and the other, and then I would have been able to do so much more today.
That's right.
So that's why I do it. It's an investment into maybe something that I'll, 10, 15 years from now. But are there specific things that you would encourage people to do from a physical fitness perspective?
Again, I think it's not like a proper regime. I can say, okay, follow this just because you're getting into perimenopause or menopause. I think the kind of exercise that everyone does has to fit to their particular body type and what they are used to. I mean, of course, if there's an obese patient who just suddenly comes, we can't tell them you start running or you start doing. So it has to be a very gradual process for everyone. It could be either strength training, it could be Pilates, it could just be a cardio. I mean, there are different forms of exercises which are available. And I think you just need to find out what you want to do and what you enjoy doing. And once you do, it really helps. Of course, strength training is important again because, like I said, you need to have your muscle strength a little later once you're getting into menopause, and you need to have your core strong. But again, I think it has to be individualized. It can't just be said that, this is the type of exercise you need to do because you're getting into menopause.
One of the things I just want to flag is that I feel like we should encourage women to be comfortable in whatever shape they are, and this is not at all about the tummy tie or anything else. It's just that exercise also makes you give yourself that time. It prioritizes, again, your own physical health, and we all know when we exercise, it's almost meditative. Yes. You are really in your body. You can feel everything that's happening to you, and it's time that you carve out of a busy day, which you genuinely should do because it's good for you and you should enjoy it. Absolutely. So, like she said, it's like whatever floats your boat. Really, you can. I think, but any amount of exercise, even a small amount of exercise would be good, I think, for women who enter their kind of mid-40s.
I agree, and I think that is important to underline, that it's not about losing weight or achieving a kind of body image.
Exactly.
It's, for me, about building muscle and strength. And in fact, I think I put on a couple of kilos after working out, but that was supposedly muscle. I'd like to think it's muscle. So these, for the right reasons. Before I come to hormone replacement therapy, which I really want to explore just a little bit, I wanted to ask about intermittent fasting because you touched upon it earlier. And I know that a lot of people are embracing intermittent fasting. Sometimes it can be up to, once a week doing a 24-hour fast. I've read and been told that perhaps for hormone regulation for women, long fasts may not be ideal. Absolutely. So is there some truth to that?
So generally, if your body is fasting for so long, so you're not meant to fast for so long. There's a little metabolism which is going on in your body. You're suddenly shocking your body, yes, by not eating for such a long time. In fact, I would say whatever, finally when you do start eating and all that's absorbed in your body and what's deposited, probably your body thinks that now, okay, fine, I'm getting food now, let me deposit it.
Yeah, hoard it.
And also what we found with intermittent fasting, there are a lot of people who start getting a lot of gallstones. All right, because of the deposition of cholesterol into their gallbladder. So intermittent fasting, that way, it's not a natural way of taking care of your diet. And I think probably to boost your metabolism, maybe having smaller meals, but having them more frequently, something that will really help you lose weight, as compared to just trying not to fast and shocking your body with no food for like 12, 16, or maybe even 24 hours.
Right.
And I really can't believe that people can go without food for 24 hours, but still.
I mean, they're not the best version of themselves, for sure. For the benefit of their family, they perhaps should not. But apparently it's very good for, I think at some point your body goes into a state where it kills the dead cells, and for cell rejuvenation and things like that.
I think in Ayurveda they do have, but it's part of like a Panchakarma kind of 10, 12, sometimes 17-day treatment.
Yes.
And it's that's a detox treatment that you do, but every so often to kind of do it.
Yeah.
would be a big shock to the system.
No, I think we want to do an episode that is, of course, dedicated to nutrition, and we will touch upon intermittent fasting. But let's get into the hormone replacement therapy. I don't think enough is being talked about in India, certainly. I know that I've asked this question many times as to what stage of perimenopause do I need to be in before I start something like HRT. I should put it off for as long as possible. And there are lots of things in the market, synthetic hormones, bioidentical hormones, how much of bioidentical hormones actually exists in India, is it prohibitively expensive, etc., etc. So starting off with HRT, what are your views on it? Do you advocate it to your clients?
So you know what, HRT is an option, yes, we do give to our patients. There are women who would come to me with that in their mind that, you know what, I am getting these symptoms and I do not wish to go through it and I would like to go on HRT. And there are women who, if I suggest HRT, would be like, no, I don't really want to go ahead and do this because
So you
I
do
know,
suggest HRT?
Oh, yes, I do. But again, it totally depends. There are a lot of women who would want to go ahead with HRT. There are a lot of women who would not. A lot of women do choose more, like I think Kiran herself said she tried homeopathy. So that's one thing I think, yeah, that is available. Of course, there are other supplements. For example, there are different types. Now, estrogens also are animal estrogens, plant estrogens. You have different types of estrogens. So phytoestrogens, for example, which are plant estrogens. There are different classes of it. The isoflavones is what we use most of the times to give to perimenopausal or menopausal women. I mean, these are not exactly estrogen or a human estrogen, but this do mimic the structure of estrogen, and that's why when they go and combine with the receptor, they would give you some benefit of estrogen otherwise. So those are drugs that people, in fact, if you tell them this is something which is natural, this is like a plant estrogen, they wouldn't mind taking that as compared to if I would suggest that, okay, fine, now you do need to start hormone replacement, unless and until they're so symptomatic that they themselves would say, okay, fine, I am having so many mood swings. I'm at the verge where I'm fighting with my husband so much, I need something. Probably I'm getting so many hot flashes that I just can't sleep in the night, insomnia. So when they come with such severe symptoms and they ask for it, yes, of course, it's readily available. But again, what's available in the market mainly is all the synthetic hormones what we have. Now, when I say hormones, of course, they do make hormones from products and mimic it as close as they can to natural hormones. Initially, when you would come into your perimenopause, some people would be in a hypoestrogenic state. In that case, we do not, of course, advocate any kind of excess estrogen. We could give low-dose pills and, like I said, contraceptive pills initially for a few days where you would have a constant dose of hormone through a month. But those contraceptive pills are combined contraception.
Sorry, why do you recommend the pill at this juncture? If you could just make that very clear.
A lot of people with irregularity in their periods when they come in, and if they're bleeding for a month and they have spotting throughout the month, and that is not something that you can live with always. So to get your periods at least in order, and at least, you can't be wearing a tampon or a pad for the whole month, and of course bleeding for such a long time would also lead to anemia because the hemoglobin would drop. So in those cases, we do give combined contraceptive pills which they can take cyclically for a certain period of time till the time they decide that they don't want to take it. Because
and when you take the pill, what is that doing?
So that pill is giving you a certain estrogen and a progesterone in a little constant value through the month. So the estrogen and progesterone is there in your body, and it does help you regularize your periods, and to a certain extent the same estrogen will help you take care of other bodily functions, what any normal estrogen would do. Now coming to bioidentical hormones, I know that's a thing. Now, unfortunately, in our country, now believe me, when I started prescribing HRT to my patients, I did go back and I did a lot of research where I wanted to know whether I can get this patch, I can get this particular cream. Because abroad, when you go to any country, United States or UK, HRT is very readily available to the women over there. And we, of course, have a lot of expats also to come to us.
Yes.
But we can't generally get the same type of estrogen gel. So the estrogen gel or even a testosterone gel that I would want to use for someone who's got decreased libido, we literally are using drugs which have been made for women who are getting treated for infertility. So there is nothing in the Indian market which is made for menopausal women as such. Because probably, like you said, there wasn't much awareness, and I'm hoping a lot of people do start now. Certain gels have come in the market, but
awareness and interest.
Interest, yes. And now certain gels have come in the market, but again, they are not very easily available and they are expensive. So not that everyone can afford it. Now, when you talk about bioidentical hormones, these are hormones, again, they're compounded. They are not something which are readily available. It's compounded and a certain whatever mixture of hormone is made and given to you.
So compounded means it is tailor-made for you.
Absolutely, that's right. So depending on what hormone that you do need exactly in your body. So pre-menopause, let's say while you're going into that perimenopausal period, by the time you get into menopause and later, you might need only a little bit of progesterone. You might need a little bit of testosterone. Maybe when we generally give you that one puff which you put like once in 3 or 4 days, might not need estrogen initially. So till the time once you're in your menopause, of course, once you're in your menopause, that's when the estrogen also drops. The estrogen and the progesterone both is gone out of your body. That's when you need both estrogen and progesterone supplements, which you start taking post-menopause then. So yes, we do get tablets very easily available over here, but for some reason, oral medication, whatever you take, do have a lot of GI side effects where people get a lot of nausea.
That's what I wanted to ask
get a lot
you.
Of,
what about the side effects of this
That's
medication?
right. So they do get a lot of nausea. They get a bit of bloating, and that actually discourages a lot of people from going ahead with HRT. So I'm hoping that maybe in the near future we get gels and we get those patches. Though those patches, of course, in India, we say with the humid weather that we have over here, especially in a place like Bombay, they don't stick too well. But I'm sure we can.
With the
that's right.
Humidity, the absorption.
Correct. But I'm sure we can come up with formulations which do work for Indian climate and the Indian women as such. So let's hope. There's a lot of research going on into it right now. But yes, I think women's health wasn't really thought of as something that important where so much research could be done. But yes, with the awareness that's coming up now, I'm hoping new things do come up in the market, which we get readily here as well, and people don't have to. I mean, when you go for compounded products, there's a very, very handful of people who have access to it, because it's expensive, whatever said and done. Not everyone can afford it. So for us to be able to have that uniformity at some point, yes, we do need to start. Maybe we'll have to tell Modi ji to do that for women's health. Why not? Because, of course, they've got the cost down of all the stents and everything else, all the chemotherapeutic agents. But there's a vast majority of women in India who are in this perimenopausal age group, probably would need that help.
I think the more perhaps we express ourselves and we're heard, then that might make a difference. You didn't ever feel the need to explore HRT. You were aware of it?
Like doctor said, I was also put on the pill, which is what I talked about, which just helps to regulate your period while you're on it. And I suppose, it can be possibly taken in the short to long term because, it doesn't have, we know the side effects quite
Did you experience the side effects of bloating? Or?
I didn't actually take it long enough. I mean, I took it for a month and then 2 months and then went on to homeopathy. But honestly, I think HRT people are just afraid of it because there were so many, there was one damning article like 30 years ago that said that it had a connection with cancer and, just from then on, people are just scared. And I think because people are scared and there's not enough willingness to try and not enough demand of these drugs, we don't get these gels or patches or things that are better and easier than a pill.
Right.
But no, I haven't actually been on any HRT long term.
Because you mentioned cancer and that would of course scare people. Is there a connection between HRT and cancer?
It's not like the breast cancer risk had increased drastically after menopause.
But of course that article is not received.
And that article is not received. And what it did actually was sort of make women go through unnecessary suffering.
That's right.
When, there is no saying, some of us are just genetically predisposed to get different kinds of cancer. So women who could actually have had a much better quality of life were just never offered the option of HRT, honestly.
Like I'm aware of HRT and even these biohormones being expensive and that of course making it less accessible and less equitable, but at least if someone is aware, they should be aware of the options that exist.
Absolutely.
Of course, we should redress the inequity as well. If you could, imagine, I'm a 46-year-old woman. It's not hard to do. And suppose you were to suggest the supplements that I should be on. Could you? Hypothetically, for other people who might benefit from this, free consultation.
Throw in a free
What should I take?
So, hormones, basically...
Not only hormones, I'm saying the magnesium and the calcium, And,
So you can take anything and everything
But what
which is
should
available.
I take?
So ideally, yes, I do tell women that at least when you're in your 40s, you must take some calcium. Though I know that whole myth. Of course, once you're menopausal, the requirement of calcium is as high as 1 to 1.5 gram per day.
Wow.
And I don't think anyone takes such a high calcium. Even if you take a 250 or a 500 milligrams of calcium per day, it's something which is beneficial
Let's just
for
take
you.
like a random 46-year-old
That's right.
woman.
Correct.
in,
So
like,
a calcium is something
perimenopause.
which is important to be taken.
How much?
500 milligrams is good enough at this age of 46. Of course, we do tell them to take a multivitamin which will have a little bit of zinc, it'll have a little bit of selenium. You have all the other micronutrients, what we call. So something like maybe a Centrum or a Wellwoman, which generally has little of all these
Not on an empty stomach,
minerals,
makes you feel
not
very
on an
sick.
empty stomach. Vitamin D again, and I think that's perpetually a problem in our country because we don't really go out in the sun too much. So vitamin D is something, of course, you can't keep taking it without getting your blood test done, because hypervitaminosis of vitamin D also can give you other side effects. So make sure that you check your vitamin levels, take the proper dosage what is needed, and then you can go on a maintenance dose of it maybe for once a month or maybe once in 2 months, whichever way that your body, when you keep doing on your blood test, you do know exactly how much is the deficiency that you have per month.
Has anyone ever been adequate? Vitamin D ever? Never.
I think I
Hardly.
have been, yeah. I took it for a while, so I think I then.
I think my
maintained
highest
it.
was
B12 was
sufficient.
the one that, because I was vegetarian, vegan, at
Yeah,
one point was
right.
like struggling with that.
Correct. So most of these multivitamins do have the B12 also. Other thing, of course, primrose oil. That's something that generally is very good because, as you're aging, you do get a lot of fibrocystic breast disease, where people do get a lot of tenderness in their breasts all the time. So taking a vitamin E and taking a primrose oil supplement is something which really helps you with that. And I think other than that, probably yes, in that perimenopausal age group, I do tell my patients to start phytoestrogens as well. So the isoflavones that we spoke about, that if you keep taking that one tablet every day, that also helps you at least to a certain extent, if not curing anything as such.
Right. Okay, done. What about DHEA? That's
So
hormonal.
generally, we don't really prescribe DHEAs unless and until we've done a blood test and we know that there is a little deficiency of DHEAs. And again, high levels of DHEAs can again cause androgenic symptoms in women. So they can start getting acne because it's an androgenic hormone after all.
Right.
So yes, DHEAs we would give only if we feel there is an insufficiency, that the blood level does say that the DHEA is too low. Again, a higher DHEAs level is what we generally see in polycystic, and you see all these androgenic symptoms where they have hirsutism, they have acne and all the other problems.
So in every episode, I have a friend, Niranjana, who you know, and she has a question every time. She says, what are you talking about today? And I have a question. So we indulge her and we ask her question, which is usually an assumption. And then we prove her wrong, or rarely she's right. So
She's a lawyer. She's
Alright.
absolutely always right, actually.
no, she's been wrong 4 out of 5 times so far. So record is not very good, but still, we'll indulge her. I think she also likes to ask controversial questions. This time it's not very controversial. She wants to know whether it's true that perimenopause can feel like a minefield for women, and it's quite unpredictable, and it really does vary from woman to woman. It's a completely different experience. Is that true?
It is. Like I said, some women might have no symptoms at all. So I do get people who say that, I didn't even know I was getting into menopause. So yes, it's very different it's tailor-made for each person. It's not something which is just there. It's not like everyone will go through the same symptoms. Everyone's going to have their share of symptoms. Like, for example, you said you had insomnia. Someone's going to be having hot flashes. Someone's going to be suffering that they have recurrent vaginal infections, recurrent urinary infections, and they keep coming to the doctors. So all those symptoms, each and every person is going to have a different symptom of menopause. They might start with irregular periods, and the only thing that's common in everyone is no period. Right. So that's also, once you stop menstruating, that's the only thing common in all menopausal women. Other than that, I think the symptoms, they could be one of the other. I don't think anyone's that unlucky that they'll have all the symptoms in them. No.
Right. When we come to, just briefly as we're winding down and reaching the end of it, support during this time. You said that, of course, lots was happening. COVID was happening, divorce was happening, perimenopause was happening. We live in these nuclear households now. We don't actually have a lot of support around us in the ways that perhaps we did from extended family in the past. We would lean on our partners. How could we help them to help us?
Well, I think probably...
Is there a pill we can give them?
I wish there was. But no, I guess it's just a kind of a thing where you just need to sit and talk to them probably. And I guess you just have
I
to...
don't know how much husbands like talking about their wives' hormones.
Sometimes I feel it's very easy to blame everything on the hormones also. I mean, I think I've used it an ample number of times that I've said, no, I've got PMS and, I mean, that it is. But yes, of course, I'm sure if you're getting to that phase of life where probably you've been together for a certain period of time and sitting down and talking about it does help.
Yes.
So yes, there are a lot of things that, I mean, of course, starting from the fact that you will have mood swings, you get irritable at small things, you are going to have some sort of an anxiety. I think that kind of a support from your partner is very, very important. And the only way that you can get through them is try to get them to sit and talk. So try and get them to sit and talk. There is no magic pill for the husbands.
Yes.
Neither there is a magic pill for the wife. Yeah. So I guess, you just have to work it out. I mean, I just think that counseling or probably sitting and talking, go to support groups, which I don't think we have too many right now. Like I said...
Are you aware of any support groups?
No,
you didn't feel the need to
more, no, I mean, I had a big support group of women. I know so many women going through the menopause with me. But honestly, this is true. I mean, it seemed to us like common knowledge amongst all of us friends, but the men in our lives were oblivious to the fact that our bodies were changing. And I think that's, so at one point you were talking about andropause. I mean, when we were just chatting otherwise, and whether they have similarly like sort of acute symptoms of any kind. And they seem to continue to think that they are 25 for the rest of their lives. So,
in fact, I forgot to ask that question. Is there a male menopause?
So, well, there is an entity called as andropause,
right.
But it's not really, the testosterone levels do decrease, but again, it's not something which is well researched into, probably because men, like she said, don't have too many, they don't really suddenly stop producing testosterone, right? So for us, it happens that the estrogen's decreasing and it's totally gone out of your body, and it happens at a very early stage in our lives. I feel 50 is early because now women do live longer. Yes. I mean, earlier I would say when, of course, the life expectancy was not so high, it was different. But now with the life expectancy being so much with good medicine and everything, I think 50 is a little tad bit early for your hormones to get out of your system.
Why so unfair?
I have no idea. Like you said, God is a man.
I didn't say God is a man at all. No. I just asked, is God a man? Just wondering. What about the professional setting? Again, as we come towards the end of this, do you feel, we've seen so many movies about pregnancy, we've seen so many movies about infertility, we've seen so many movies about puberty. Have you seen any good movies about menopause?
Honestly, not really. I mean, I've seen lots of lovely sort of films with older women kind of finding themselves and connecting after having sent their kids off to college and all the rest of it. And everyone kind of just sort of fast forwards past that part of their lives when they're suffering for those years. And I don't think it's been actually adequately either shown in film or in any kind of general media as just awareness, that people even know about. So, no, I have not. And even fertility problems, honestly, while I know we've seen people have fertility problems, it's not, I don't think, been there and even commonly addressed in film. And I know that I went through a lot when I was trying to have a child. So these are, I mean, I think the woman's experience is anyway underrepresented in film, and there's lots of opportunities there for storytellers.
If there's one thing, Kiran, you could tell your younger self,
I would, no, actually more than that, I'd love to give advice at this point, having suffered myself, my younger self having suffered, is that I kind of think that it's a great time to remember that, we are much more than our bodies, and that we will go through this suffering and we will change and we do age and we do die. And it kind of brings all these unpleasant things to the fore, which are very important for us to sort of, again, normalize. Death is a normal part of life. So it kind of puts you a little bit in touch with that, because you begin to see yourself change. When you're aging, all of us want to fight it desperately. We don't like the way we look in pictures. We don't like the way our bodies now fit clothes.
Everything is HD now.
Everything is HD and sharp, and every wrinkle is up there for people to see, and
and comment on, and of course they comment on the women more than
yes, of course. And your weight or your hair or there's so many things for you to not like about yourself. And I think it's a great time for you to kind of remember that you are much more than that, and that this is a great vessel that we've been given to live in, this body of ours that does so many things for us. It's just magic. So to treat it with a lot more respect, to love it a lot more. You don't know how long you have in it. So it taught me a lot, actually. Menopause gave me a lot of, post the getting used to the struggles of it and being able to find ways around it. I think it really made me more comfortable now with the next phase of my life.
Yeah. And I love what you said about you living in your mind and you coming into contact and really connecting with your body, which you're forced to do during this time. So if there's one thing that you both wished that every woman understood about perimenopause, and I know you might be repeating yourself, but what would that one thing be? Dr. Rao first.
Well, I would just say that when you're getting into your perimenopause and menopause, of course, there are ways to go through it gracefully. And yes, there are times when probably you will feel very, very low and you might have mood swings and you feel that, there's nothing remaining in this life. But then look around. There are ways that you can meditate, you can take care of so many things, and you can do so many things to make yourself feel better. And eventually, like she said, it's all about self-help. It's about taking care of yourself. And that's what I think every female has to, at that point of your life, so you might have a child, you might have a husband who also probably need all the attention, but you know what, you need to concentrate on yourself and take care of yourself. That's important.
Yes, absolutely. If you had to put together a menopause kit, what's one thing that you would insist be in it, and what's one thing that you would insist be in it?
Only one thing? Okay, I would say just exercise, but in two parts, like exercise your body, but also meditate. So I know it's not really exercise, but it's exercise for your mind. I think it helped me cope with menopause a lot.
Yeah.
And also always remember that this too shall pass and you'll be fine at the other end. It's just being able to keep your sanity through the perimenopause years.
I think that is advice that helps you through so many challenges because you feel like you're going to be in that moment forever. Whenever you're going through something that causes you anxiety, you're like, this is lasting forever, and just to realize it's a phase and it will pass.
Too shall pass.
And this urinary infection will be over next week.
Yes.
One thing in your kit?
So as a doctor, I would always say carry your supplements. I really don't know what else to say.
Yeah.
Because, rest, everything, of course, your lifestyle does come in play. But yes, get your supplements in order. Take care of your nutrition. That's important.
Thank you both so much for helping us, for educating us, for sharing. It's meant a lot to me. And I've made all my notes. And you guys have really benefited from a free consultation. So thank you.
Thank you. My
Thank
pleasure.
you so much.
Today's conversation was a gentle reminder that perimenopause is not the end of something. It is actually a new beginning. A phase that, yes, it brings change, but it also brings with it strength, awareness, and the opportunity to know ourselves better. Whether it is navigating our mood swings, disrupted sleep, shifting relationships, or just finding the right support. What really matters is that we keep the conversation going without shame, no silence. Thank you to our wonderful guests, Dr. Gayatri and to Kiran, for bringing in both knowledge and also practical lived experience to this space. And to everyone listening, please remember that you are not alone. This too deserves to be talked about. And until next time, please take care of yourselves and take care of each other. Stay informed, stay healthy, and we'll see you in the next episode.